Hello, I'm Stewart Wright. I'm an emergency physician and Associate Chief Medical Officer for UC Health.
And I'm Jennifer Forrester. I'm an Associate Chief Medical Officer and an infectious disease doctor. So we are 6 feet apart. Six feet apart, and everyone else in here is 6 feet apart as well. We have both screened negative at the entrance, so it's safe to take off our masks.
I think it's important to note that the masks are highly recommended and obviously required now if you're on the grounds of UC Health. Go ahead.
All right. Ivermectin is an anti-parasitic agent that's usually pretty well tolerated. Some studies have shown that in a petri dish with some cells, it does decrease the growth of COVID-19. That's very promising, but at the same time, how a medication works in a petri dish is very different than how it works in the human body, or even the animal body for that matter. So it will be interesting to see how that plays out, but certainly we have to take into account metabolism, so how our bodies use that or break down that medication, the dose of the medication that's useful to do that, and of course, if it gets to the right tissues that we need that medication to get to.
I think it's a good summary, and I think I would just say that it's a great first step and requires further investigation, but I wouldn't take this as proof that this is going to help humans with COVID-19.
That's right.
I think that's a great question, and
Yeah.
I don't think we have a great answer for it as of yet. As everybody knows, it's a new disease. So if it acts like many other diseases from the past, then yes, you should have some protection if you've had the disease once, but we don't really know that to be certain at this time.
COVID-19 is similar to obviously other coronaviruses like MERS and SARS. And there is some data from MERS several years ago that people did have some immunity for some period of time after infection. But again, each virus is different and can have different properties. So this will be something else that we see in the future.
I believe it is.
Yes.
I think we've all read that. It sounds like more than one tiger from what I was reading last night. And it sounds like this disease can be spread through many animals, not just through tigers. So I think Jen said that when they're actually passing information to the ambulatory areas, they had a caveat about that in their instructions.
Right. So this is a good reminder that this virus is not only a human virus, and that whether you have a tiger pet, like some people do, or a smaller feline or a smaller canine, to actually quarantine yourself from that pet if you are ill. And if the pet looks ill as well, that they could pass that to you. So again, try to avoid the licks on the faces and that kind of thing.
Good advice, but what I read was the tigers are all expected to make a full recovery.
I think just making sure that you would be able to be at home for a extended amount of time if you do become ill or need to quarantine yourself from others, that you have enough food, obviously water supply available at home, certainly cleansers and alcohol hand sanitizers, or even just plain old soap is good as well.
I think those are great places to start, but we should also remember that it's a very stressful time.
Sure.
Obviously, it's a dangerous disease, but it's important to remember that the vast majority of people that get this disease come through just fine. But we should recognize that there's a lot of stress and a lot of questions about what's happening, and so any type of stress relief that you can do at home would be important. I know a number of my partners are using yoga, meditation, even exercise, etc., to try and make it through all these times.
And a lot of these apps are becoming more and more available on the phone and accessible to everyone, but that's a great point.
It's a good question. I think the governor has now recommended that we do whenever we go out into public spaces. I think the way to think of this is you're trying to protect not just yourself, but also others around you if you have the disease and are an asymptomatic carrier. So you're trying to stop spreading it to the checkout person at Kroger's or whatever the case may be. So I think it's a very good idea, and we should probably follow what the governor's telling us.
Exactly. And remember also that to still wash your hands after you come back from the grocery store. Try to avoid touching your face, and still while you're in grocery stores to maintain that social distancing if possible, so more than 6 feet away from others.
And I think it doesn't matter what type of mask you wear.
Correct.
Actually, specifically we discussed the N95 masks, which are one, expensive, and two, a little bit more difficult to come by. So we really should be saving those for people that are doing procedures in hospitals that that require it, and just a simple paper mask like this or even a cloth mask that's homemade should be adequate for the job.
Yes, those cloth masks can protect others from your droplets, so coughing, sneezing, even sometimes breathing should be sufficient for that.